I gotta make sure you got no holes in your legs. Yeah, if you bleed to death, you won't need pants. He doesn't want to go to the hospital.
Well, no, he does not believe in doctors.
How can you not be concerned over his safety or her safety? The fact that he doesn't believe in doctors concerns me, that he doesn't understand the nature of his mental health history.
Can you look at me? Look right at me.
So she's looking past me like there's nobody there, just staring off into space.
Hey, calm down for us.
Then you have no friend.
Hey. No.
It's 2 minutes 27 and 73. You're responding Delta for a 23-year-old male who's been stabbed. City police are en route.
As we pull up on scene, we really don't know what we're walking into.
I see the patient has a puncture wound to his upper left abdominal quadrant, and my immediate concern is for the underlying organs. Do you have pain here? Can you stand up?
The reason that we need to get him going so quickly is because we don't know how bad he's bleeding internally. 1, 2, 3, up.
It's okay. Let's go. Yeah, we'll get your shirt. You got a hole by your spleen. We need to go. We don't need the shirt. We don't need the shoes. We need to go. I'll do everything on the way. I'll get you some vitals here quickly.
Level 1, I guess, eh?
As we're loading up the patient, the police inform me they found another patient hiding in one of the bedrooms.
These guys are leaving, but I can come and check them out. What's that, blood? Hey, bud, roll over so I can check you out.
I gotta make sure you got no holes in your legs. Yeah. If you bleed to death, you won't need pants.
Okay, look up.
The patient I have has a bloodied lip, has some dried blood in his hair. It looks like he's been assaulted too.
There's an organ underneath there. It's called your spleen. And that thing's got a lot of blood in it, and if it gets lacerated from a knife, it bleeds lots.
Just gonna check his neck here.
I don't know if it's been lacerated, but we're gonna prepare like it has been.
Could I get another transport unit to this location?
If you can pick a spot to get stabbed, that's not the place. The patient is stable right now, but I don't know what the outcome is going to be in 5 minutes or 10 minutes or an hour from now. Was there a verbal altercation, or he just kind of walked up to you and stabbed you?
Touched me, he hit me, then I punched him 2 times, and that's when I looked at my stomach started hurting me.
A different angle, maybe a little bit longer time between the injury and the time we got there. Outcome could have been quite a bit different. He easily could have died from an injury like this.
Base to 23. This is an echo response for a 31-year-old female patient. She's taken an overdose. She is unconscious, not breathing.
We roll up on scene to find city police standing over our patient on the sidewalk. Flashlights on her. Nobody's doing CPR at that time.
Can you look at me? Look right at me.
So she's looking past me like there's nobody there, just staring off into space.
Look at me.
And as I bend down to feel her wrist and her pulse, I would expect it to be a little bit fast, but it's not.
Just spaced out on something here. Oh, yeah. Can we stand up? Can we stand up? Give me your hand. No?
She got woken up abruptly because people were concerned about her.
Can you stand up?
And there's hands grabbing her and people are telling her what to do.
Well, you're laying on the ground.
Like, no joke, she wasn't breathing. And like 2 or 3 pumps of CPR, and she's
Yeah.
like, what the?
Yeah.
So, I don't know, it just kind of came back after that.
Okay, no, I'm not gonna do anything. I'm not gonna fight you. I'll leave you alone.
Relax.
It's not uncommon for somebody who is intoxicated on drugs or alcohol to become extremely agitated.
Leave me alone.
Hey. You gotta stay on here, okay?
I'm not gonna fight all of you.
Okay.
Leave me alone.
Please, okay?
I just want to get you.
Did I ask for help? No, I didn't.
Hey, calm down for us.
Then you have no friend.
Hey. No.
I can tell that she's scared, so speaking to her calmly and reassuring her is important.
We don't care about those things. We just want to help you, okay?
Can you at least ask me to
Grab my hands.
Okay.
I will give you my hands willingly.
Okay, we're gonna let go, okay? And also letting her have some sense of control is really important.
Get him away from me. Okay.
Say you're sorry, okay?
Get him away from me.
Patients develop this irrational dislike for paramedics all the time.
Get him away from me.
We're gonna go in the back of the ambulance, okay?
Ambulance, okay?
So you have to have a thick skin and not take it personally.
Just don't flail around. Get him away from me.
Drugs and alcohol make people think really irrationally, and sometimes people don't like you when they're on drugs and alcohol.
Get her away from me. I don't like her.
Hey.
I always try and remind myself to treat people equally. I don't have to agree with people's life decisions, but I still have to respect them because we're all just people and we all deserve to be respected.
Can we take your blood pressure and your blood sugar?
Not until we're on our way.
Not until we're on our way. Yeah.
With this patient, there's probably a deeper issue going on. Maybe she feels marginalized. Maybe she feels like she's had some negative experiences with first responders. But at the end of the day, we're genuinely here to try and help her.
I better take this just in case.
Called for a 36-year-old male who is unconscious but still breathing. We don't have a lot of information at this point in time. We don't know if he's unconscious because of a medical issue, because of drugs or alcohol, or because of a potential injury.
Thanks. So we walk in, I see the fire department has arrived just before us, and the patient is conscious and alert, lying in bed.
This is Alan.
Hi.
A little bit trouble kind of getting a history from him. Sorry, what we got so far tonight is that he ate a little bit of marijuana.
Yeah, he was just sitting on his bed there, holding a cigarette. It was lit.
Okay.
But then I couldn't get him to straighten out. He was just stiff. That scared me.
What was your night like tonight? Kind of explain what was all going on and how all of a sudden the paramedics ended up here.
I was trying to watch a figure skating thing on TV.
And who are you to him?
His mom.
His mom.
So do you have any medical problems tonight? Anything bothering you?
Well, it's the normal sequence of stuff happening.
Okay.
Over and over again until it happens again.
That's not an ashtray. That could burn the place down.
Do you have any mental health problems? Bipolar, depression, anxiety?
None that I agree with.
None that you agree with. Okay. His answer is a little bit atypical. Somebody with mental health history quite often will voluntarily say, I have depression, schizophrenia, anxiety, but his response is none that I agree with.
That is why we're living here. He burned down the place that I lived in before.
What have you been diagnosed with?
Bipolar and schizoaffective.
There's a story being told here, and you want to get the perspective of everybody involved and kind of blend it into one cohesive story. Do you want to go to the hospital tonight?
No, I really don't want to.
And I got a call saying that maybe you should go home because your son called. It sounds like your house is on fire.
Okay, I'm just going to chat with your mom here for a minute. Oh my God. So, he doesn't want to go to the hospital.
Well, no, he does not believe in doctors.
How can you not be concerned over his safety or her safety? The fact that he doesn't believe in doctors concerns me that he doesn't understand the nature of his mental health history.
Let's go now. I'm not leaving your room until we go. So let's go.
But unless he's willing to agree to go to the hospital, there's just not much more we're able to do.
That doesn't matter.
It does matter.
This family obviously has a lot of issues going on, and unfortunately, it's not something that we're able to resolve for them.
Put your shoes on, let's go. Why are you not talking to me?
Well, it's a tough spot for him to be in and his mom to be in. He does have a mental health history. He's not actively a threat to himself or others, even though he was smoking in his bedroom. It's more of a matter between him and his mom at this point, and I've explained to her options in the future if she feels like he's a threat. And that's about all we can do. We tried to convince him several times, several different ways, and if he doesn't want to go, that's the choice that he has to make. Regarding the call we did earlier in the night with the mom and the son, he wants people to know that he was in a really bad place. He doesn't want to go to the hospital.
Well, no, he does not believe in doctors.
And that him and his mom are doing much better now.
We don't care about those things. We just want to help you, okay?
And Gabby is pursuing a new career path. We wish her all the best.